Okay, this will be the obstetrical emergency childbirth delivery. Step 1, take body substance isolation precautions. Step 2, assess mother's history. Last menstrual period and or expected due date. Prenatal care. Gravida para. Rupture of amniotic membranes, color and odor. Vaginal discharge. Bleeding or bloody discharge. Any problems with this pregnancy? Multiple births, twins, etc. expected. Type of previous deliveries, if indicated, vaginal or cesarean. Any problems with past deliveries? Diabetes or drug use, street or prescribed. Next step, assess contractions. Frequency, duration, intensity.
How do you do that?
That's what I'm saying.
Show me.
Show us, Chris.
Do
that. But you asked them that, don't you?
Don't you have to ask her last?
Ask her, Chris.
He did. Well, he was verbalizing.
You want me to be the head?
Yeah, you be the head. Sit down on the chair. Yes, sit down on the chair.
We're going to connect.
Be the head.
Okay, I'm the head. You can ask me. I'll answer the question.
Big ass body.
Okay,
The rest of my body.
where are we going back to? Contractions. Assess contractions.
Okay, do you know when your last contraction was and how long it was?
It was 2 minutes ago, and it was about 3 minutes.
Okay.
Determine if delivery is imminent, which includes crowning present, contractions.
You were going to check that.
I'm sorry.
You're evading me right now.
Contractions 2 to 3 minutes apart. Mother has the urge to push.
Do you have the urge to push?
I do.
Determine additional resources and specialized equipment.
ALS.
To include, as an off here, maintaining privacy for the mother is essential. Have oxygen. Have oxygen.
Get out,
perverts. Etc.
That's what he is oxygen.
Next step: put on protective equipment. Gown with long sleeves, face mask, eye protection, gloves. Position the mother. Place in a semi-Fowler position. Elevate buttocks with a pillow or blanket 2 to 4 inches.
Shut up, bro.
Remove clothing that obstructs the perineum. Pull up knees and spread apart. Open the obstetrical kit.
Oh, no, the way it's covered, right?
I know.
What's that?
All four, the legs, the abdomen.
That's after
Not yet. Yeah, you have to open up the kit.
Okay.
Cleanse the perineum with cleansing towelette and germicidal wipe. Remember, 1 wipe, 1 swipe. Or was it 1 swipe, 1 wipe?
One wipe, one swipe.
Yeah,
Okay, so you wipe and then...
that's what it says here.
One wipe, one swipe.
It's going down from top to bottom.
Top
right?
to bottom.
Yeah, top to bottom.
All right.
Don't mix the anus with anything else. That's the easy way to remember well. Put on sterile gloves.
You have to
Nah.
I was
Come on,
gonna say,
Elac,
when we're
fool.
testing for this, are we literally doing it or not?
Just we don't.
Yeah, you gotta come in with the gown and everything.
Drape mother and establish a sterile field around vaginal opening. For draping, you put 1 sheet under the mother's buttocks.
He does it. He does it. Oh, okay.
There's the 1 sheet over the abdomen and upper legs.
Good narrator, man.
Don't drop me there.
1 towel over each thigh.
That's 1, 2, 3.
And it was was already put down, but one towel under buttocks, which can be removed in case of fecal contamination.
Okay.
There you go. Okay. Now we're ready to deliver the child.
Oh, it doesn't come out?
Remind me not to have him do a C-section on it.
Come on.
He's on top.
He got it.
No, this one can't.
Oh, okay. It's a dirty
Okay.
baby.
You ready? Support the baby's head and apply gentle pressure to the perineum to prevent explosive delivery. Keep one hand on the baby's head. Apply pressure to the perineum with a sterile towel. Rupture the amniotic membranes and pull membrane from baby's mouth and nose, if not ruptured previously. At this time, note the color and odor of amniotic fluid, if the membranes were not ruptured previously. Check for umbilical cord around the neck as soon as head is delivered. If no knuckle cord, continue with delivery. If knuckle cord, loosen cord with 2 fingers and slip over baby's head, and if necessary, clamp in 2 places, 2 to 3 inches apart, and cut the cord. Clear the baby's airway.
It's right there.
Where's assistant? Mark, let's go.
Suction the mouth 2 to 3 times. Suction each nostril 1 to 2 times. Assist in releasing the shoulders. Upper shoulder, guide head downward, if indicated. Lower shoulder, guide head upward, once again, if indicated.
So which one is it?
Yeah, what is it?
Lower shoulder.
Which one?
Lower shoulder.
Lower?
Lower?
They go down and then
Go up.
Assist in delivering the rest of the baby. Note, as the feet are delivered, grasp them to assure a good hold on the baby. Hold baby securely. Place in Trendelenburg position.
shock.
Support the head at the level of the mother's perineum. Wipe and suction the baby's mouth and nose again. Stimulate the baby to breathe, if indicated. Vigorously rub the back with a towel. Flick the soles of the feet. If no response, after 5 to 10 seconds of stimulation, ventilate baby with bag valve mask. Next step, double clamp the umbilical cord.
That's pretty one on. Okay, pause.